Let's talk a little bit about what happens when you're in a seated position, what that has a tendency to do to the spine. In general, when we have a disc that's already herniated, it means that there's a lot of pressure and that little jelly component is sticking on out. When we sit, that pressure generally for most of us is going to increase, and it's going to get quite uncomfortable the longer that you sit. So that's a very pretty much well-known idea. Now, to expand upon that, the way that we're sitting is actually extremely crucial as well. So let's go through a little bit of maybe not the most ideal way to sit, and then maybe a little bit of a better way to sit. So in general, if I'm seated and my knees, you can see here, even if I'm seated in a good posture, good position, and my knees are above my hips, they're a little bit higher than my hips here, that's going to put a lot of pressure in that lower back. The more that we have the knees go up, the higher they go up, right? The more, even if I'm in a good position, the pressure is going to continue to rise. And not only that, it's going to cause me to naturally start to go into more of this position. And when I start to fade this way, additional increase in pressure in the lower back, which is not really going to help that. So as we sit and the knees go higher in general, the pressure also goes higher, okay? Now, the reverse is true of that. As the knees start to drop, in general, the pressure will start to drop, and it starts to almost mimic as if we're standing. When we stand, compared to seated, the pressure decreases by approximately 35%, okay? Now, looking at how to sit in a better position, right? So what I'm going to do, I would never have the stool this low necessarily, unless I was doing some kind of a work down low. In general, for me, I definitely want to have things higher. Now, as we can see, when I'm sitting here, what that's going to do is my knees now are definitely lower than my hips. That decreases the pressure within that spine. And when it decreases the pressure in general, I'm going to probably start feeling better. And that also allows me to be more natural. And I usually generally will sit in a better position. In other words, it's a lot more difficult to sit in this position with my knees lower than my hips and then have me do this. Although it's possible, it's definitely easier to sit up higher. So make sure when you're seated, the two biggest places, I guess, where we spend most of our time seated, in general, most of us is probably in our car, vehicle, and or at our office or at our job. So make sure in your vehicle, as best as you can, get that seat up as high as you can in general, as long as it's safe and you can touch the pedals. Most of us can. And that's going to be a really good thing for you to do in your back. Whenever I buy a new vehicle or I rent a vehicle, I usually have to do that check and make sure that I can raise that seat high enough, because that makes a dramatic difference of how I feel in my back. And then number two, obviously make sure you have a proper chair at your workplace that allows you to adjust that and make sure that your knees, again, are lower than your hips. Try this out, see if this can help. If this is helpful, please pass this information along. If you're doing this and it's still not helping, or you're still having pain, it may be indicative that you have a significant disc herniation and you need some specific treatment in that area. If that's the case, please feel free to give us a call, 619-298-0800. My name is Dr. Cassidy Boelk. I'm a certified spinal decompression doctor and a doctor of chiropractic here in San Diego, and I'm more than happy